it. Okay, we'll give it a couple more minutes and see if anybody else pops in here. Keep putting the baby to bed. And if that is your world, you guys can always unvideo or eat dinner or whatever you need to be doing. And then I said this last week, but I am recording these. So if you miss it, like we want you to have all this material as much as possible. One more minute here. Who is the person that comes to a Zoom meeting 9 minutes early? One of you did.
Probably me. It was me.
I was like, psychopath is in this meeting 9
Well,
minutes.
I missed the last one, so I was like, all right, I gotta be close.
It's like
I showed up an hour early because I don't know what Pacific time is.
Oh, right. That's true. Okay, that's true. But
I had to look that up.
Like, it comes 9 minutes early and they're just like staring at you. It's the worst. And when you guys start your own practices and then they're the only person waiting for you, it's bad. You're like, back outside. I'm not ready for you. I'm eating my snack. Okay. Well, we can get started here. How is everybody doing? How's the material? Kind of embracing this new concept here.
Yeah.
Give feedback. Josh, what are you thinking?
I thought it flowed pretty smoothly. Like it was easy to follow, and I definitely like the option to be able to replay just these meetings. But I like the links you put up for also the podcasts because that allowed me to listen to those while I was doing other stuff.
Yeah, good. I know. I think part of what our goal was to synthesize all the material that we like. I mean, there's just so much information out there, and just sort of like package it for you. Like, here are some things that we think are helpful. Yeah. So in the first lectures, we talked about the kind of the landscape of physical therapy now. And I imagine that you all were like listening to that lecture, nodding your head in agreement, right? And some people like see these settings of like kind of these mill settings more than others. And then we talked about payment model. And then Kate and I both broke down like how we started our own clinics and what they look like and why we did that. And so we kind of want to know to start this meeting, like, and most of you put this in your homework, but why are you making a change for yourself? So I don't really want to hear right now that you want to treat one-on-one for an hour. I want to know, like, what is it for you that is like instigating this? So Josh, do you want to start since you're new to the group today?
Yeah. Honestly, I like the creativity for it. I keep running across, because I currently work for a physician-owned practice and trying to be kind of micromanaged as far as what I'm allowed to treat and how I'm trying to treat. And then after listening to those lectures, we also had a business meeting and they talked about financials. And I realized I'm averaging like getting 35% of what I bill out paid back by insurance. And that just made me sick to my stomach.
Okay. So you want to make more money?
I want to make more money and have a little more freedom.
Yeah. Okay, good. I want you guys to be really truthful here with like what matters to you, because I think we kind of feel ashamed sometimes when we're like, I want to make more money, but like, that's fine.
Yeah.
It's normal. We have student loan debt and all that stuff. Okay. I'm going to make a little list here. So you want more like creativity and freedom. What do you mean by that?
So outside of like treating one-on-one, I'd like the option to be able to do a little more interventions. I know I get a lot of I shape it to how I want to treat. Like I do a lot of hands-on, but then I feel like with our current model, I'm seeing a lot of patients at one time. And then also the docs are sending scripts down that they want me to do Ionto on so many people. And I refuse to do ultrasound, but they kind of micromanage on like what we're trying to hit. So I just would like to be able to like program out for my patients a little more efficiently instead of being forced to kind of typecast everybody in certain slots.
Right. like give them a treatment plan that you can stand behind that you think is appropriate to them.
Exactly.
And sometimes that'll look like less frequency. Sometimes that'll look like more frequency. Sometimes that'll be higher level. Yeah.
Mhm.
Okay, awesome. All right. Who else wants to chime in here? Why are you making a change for yourself?
I'll go.
Sure.
So there's kind of a story behind what facilitated my decision. And this was, I work for a hospital-based outpatient, and they were contracted with a bunch of physicians that we worked very closely with down the hall. And the physicians decided to leave. So that left like a huge hole in our practice where business just went down. We tried, they basically are sending us other places. And I'm mostly just tired of their, they don't really have, like Mercy doesn't do direct access. Like you always have to have what they call a physician champion. So I'm tired of being tied to physician referrals. And I came up with a program idea where it would drum up business, but my two bosses just like are kind of shutting it down. Like they're not really allowing me to do that. So I feel like they're putting me in this box of like, Andrea can only treat patients and I want to do more, but they're kind of tying my hands with it. So I'm just feeling very held back and kind of undervalued.
What's their reasoning? What are they telling you?
You know, I want to take a few classes in order to like really feel comfortable, get this going off the ground. The class is like $600. Like it would literally pay for itself within like 3 patient referrals. But they just keep telling me there's no money in the budget. There's no money in the budget. So finally I was like, you know what? Maybe I'll pay for it myself and I will start my own business and then I will start the program independently. So.
Okay.
Yeah.
Yeah. Good for you. So again, that's a situation of like kind of wanting some freedom to do like to program how you want and to like reach out and network to people the way that you want to.
Yeah, I think ultimately it's a little bit like I want more responsibility than just being seen as this clinician who, you know, sees people and then sends them out. Like kind of, I don't know, like I don't want to be a supervisor necessarily, but I also want to have a little bit more control over my own schedule and who I'm seeing.
Autonomy. Yeah.
Yeah.
Right. I know that resonates with other folks here. Jordan, you're like nodding your head. I want to hear from you.
Yes, you know, I'm Jordan, by the way. I wasn't able to attend last week. I actually had no surgery last week, so pardon my appearance. I'm fine. I still have some residual bruising, but yeah. So everything that Josh was saying, I actually currently work for a physician-owned practice as well. I have worked for a hospital system in the past. And I think it's just a lot of, you know, we're getting these protocols sent to us from the physicians and everything has to be exactly the way that they do it. Some of it might be a little bit more old school where they're not really up to date on PT research. So again, just kind of being forced to treat a certain way. But I think the big push for me was the physician-owned practice was okay, but with everything that happened over the past year, the practice started to merge with one of our hospital systems here. The merge ended up not happening, but the company that I work for started kind of taking all of those things that people leave the hospital system for, just like, again, like the high volume, you know, decreased people. It was like they merged, they started to merge, they got all these kind of crappy ideas from the hospital system and took those new policies on, didn't merge, but are now still following those old policies. And it's just, I've started to realize over the past couple of months that it's just getting worse. Like I'm getting less PTO time. They're wanting me to treat more patients. If we want to take a day off and there's already 1 or 2 PTs off, we have to find that off. So again, for me, it's a lot of just even that family, like work-life balance. And we have techs that we work with. So a lot of the times I feel terrible because I end up sitting and staring at a computer, and documentation is a big thing for me. I hate documentation. So I really struggle with having to stare at a computer and have 2, 3 patients at the same time. So my tech's basically reading them while I'm over there documenting that. But that's the big things that I'm really struggling with for my current position. That's pushing me to do something more on my own, because I just know I can be a better PT, and my patients and the people in my community just deserve better. I pause.
I'm muted. Sorry, I was muted. Jordan, thanks. Yeah, you were breaking up a little bit, but that's good. We got the gist of it. What else? So we've got make more money, creativity with treatment, kind of untangle ourselves from MD referrals, take on more responsibility, autonomy. We hate documentation. What else? What
Yeah,
about?
sorry, my computer is being weird.
It's okay. You're okay. What about working with specialty populations? Yeah, we saw that a lot in your homework too. So fitness athlete, dancers. Mary Kate, what's on your mind? Why do you want to make a change?
Yeah, so just background, I'm in a multidisciplinary office that's Chiro owned. And recently with some of the reimbursement changes, instead of referring to PT, everyone's getting referred to OT because they're not capped. So where PT only makes $52 a visit, OT's making $200 to $300. So they're kind of only giving me Medicare patients right now because they figured I'll eat up the Medicare cap while OT sees everybody else. So I just
the kind of patient you want to see typically.
Right. Yep. I started with this company because you got to see a lot of like weekend warriors and those kinds of athletes. So now it's just hard to treat the same population like that when that's not really my passion. So I kind of feel like the same as everybody else, tidbits. But that's my big why I want to work with overhead athletes. Is my big thing.
Yeah. Okay, good. I like it. So, Kate, did you have anything you wanted to add here? I saw you reaching forward.
No, just ignore the baby music in the background. So yeah, I mean, I think all of this probably resonates with everyone else as you're saying it. Like, I think what we really want to note too is like Sarah said earlier, like be honest about it. Like the things that you're really sick of in your clinic and you're burned out and like everything else, like this is a good place to kind of get that all off your chest, because I think the reason we want to get it all out here is because we often see that come out in like the marketing that PTs try to do to patients, where like really we need to be distinguishing between like, why am I leaving? Like, why am I starting my practice? And why is this important to me? And then what do my patients actually care about? So like we see this stuff like in social media where people are like, this is why insurance is bad. And this is why like, and sometimes when I see that stuff, it's like, is that about you or is that about your patient? So like, I think sometimes it's like, we need to just get all of our frustration out of like, this is why I'm making a change and this is why it's important to me, and just like get it all out there. But then why is this problematic? Like, is this problematic just for me or is this problematic for my patient? And like, what message can I actually use to target my patients? And like, because some of those things are the same, like there will be overlap, but there are some things where like we think our patient is really going to care, but like they don't really care that you're burned out. Like we care a lot that we're burned out. but like maybe they're actually getting really good insurance coverage. And like you hate submitting to insurance, but your patient is getting reimbursed really well and like it works for them and that's their plan that they want to use. So I think like, especially right now, it's like, I want to just hear like, these are all of the reasons that I'm frustrated at my job and like, I want to make a change and this is why I want to go into business for myself. And then we can start to like tease out what's for me and what's for other people and for my patients.
Perfect. So like Kate said, we will see a lot and it's likely that most of us on this call are following other PT entrepreneurs. And so you will see this showing up in your social media feeds, right? And a lot of times the marketing message is, I'm going to treat you one-on-one for an hour, right? You're with a DPT. You're going to work with somebody who's not burned out, who can give you their full attention. Like, let's get it out now, because as a consumer, that's not why people are coming to see you, right? So yeah, this is your therapy like opportunity. But so let's kind of shift gears and talk about, what do you think, and you can talk specifically about your own patient population or the population that you want to treat, like in Mary Kate's position, but what do you think those patients actually want? Like, how can we actually like market to them in a way that will resonate?
I know for just my experience treating CrossFit, I had like a little side hustle in a CrossFit gym before I had my baby. I don't know if I mentioned that before, but I know for them, it was just seeing a therapist who actually knew what they wanted to do, like for their exercise, because they had seen doctors who were like, oh, you shouldn't be lifting overhead anymore. You're past this age, so you can't be doing that. And, you know, as CrossFitters, they were like, well, I do that like fairly regularly. So they wanted, you know, they wanted a PT and a healthcare professional who are, they're not just going to say no to them. They're going to encourage them to get back into it and get healthy.
Right. So somebody who speaks their language and can advocate for them.
Yeah.
Yeah, I love that, because I always argue like those CrossFitters are going to keep doing what they do. So you just lost a patient. They're going to go somewhere else. Or they're going to think PT doesn't believe in what they do. Okay. What else are the patients like? What maybe have they not received elsewhere that you can offer them, or that would be different?
Can you guys hear me?
Yeah.
Yeah. I think I have a list of a couple things I wrote down real quick, but one of the things was consistency. They want to consistently see the same person. That's a problem in the clinics I've been working in, is they're seen as dollar signs. There's no value beyond their dollar amount in the clinics that I work in. And so they want to see the same person because they build rapport with us, right? We see them so much beyond any other healthcare provider that they want a continuum of care with a provider that's competent. And so I think it's a big draw to be running our own clinics, because we had the guts to do it. So we better be good at what we're doing, you know? And so I think communicating that, but I think that's what they're looking for beyond a good listener. I think everybody wants a good listener in healthcare, but so yeah.
Kate like always says it this way, and I love this. She says, people are literally paying you money to hang out with you. Like, and we all have those patients that have followed us for years, and you're like, why do you keep coming? Like, I am not your best match, but they just really connected with you, right? And because of that, you can get them to do what you want them to do. But they're literally now, if you're planning on going cash, they're going to pay you money to hang out. So bring it, right? Like, what are you bringing? And like Lauren said, like, sometimes that's just the consistency of being there, like weekly appointment or whatever. What else is on your list, Lauren?
Yeah, Lauren, what else do you see that people are actually frustrated by? Like, because I think sometimes like we see the problem in that like corporate mill setting of like, this is what's so problematic and this is what I don't want for my patients. But like, what are they actually recognizing and thinking they want something different?
Different. Sure. So, I mean, the biggest thing is being passed off. When we even get people from other clinics, it's like, oh, I was at this clinic and I saw a different person every single time. So that's the number one. And the number two is people make comments all the time. So we see patients for an hour, but we schedule every 30 minutes. So we're handing off a lot. Or if I'm not handing off, I'm having to yell across a room, or kind of maneuver between, and they do not want that. I wouldn't want it either. I mean, they don't want that. So the one-on-one care is huge. But really, another thing, because I treat lymphedema patients, which is specialty, but also I find it in my other athletes and stuff as well, is they want somebody they can come to and ask questions. Like if they don't have that consistency of care, like I'm getting emails from people who aren't currently patients, right? That are like, hey, what should I do about this? Or because I've opened myself up to that, but I don't think that's a corporate thing or a large clinic thing. I think that's an individual thing that I've set up with patients, that accessibility. So, they'll complain that so-and-so didn't answer the phone, or I can't get a hold. I don't even remember who I saw, so just being their person at the end of a road of the healthcare road, in whatever avenue they had to go down, and being that person that can answer the questions and continue to do that even when they're done. A touchstone.
Yeah. Like it.
I have all of this written down on a napkin, by the way, in case you're wondering, Kate. That's my life right there.
That's how you write it.
Yeah.
When you think of something, write it down. Okay, so Nick and Anna, who just joined us, we're talking about the difference between what you want by starting your own practice, like what's driving that decision, versus what you think your patients actually want from you. Right. So I'll let you kind of gauge if you want to jump in here. But Katie, can you chime in here? Because you've been in solo practice on and off for a couple of years, and you do have a specialty and a specialty like location. So what do you see with what your patients want?
I think the biggest thing is they don't want to be told they can't do the things that they want to do. So I think CrossFit has a bad rep for that, as far as like going to doctors and even other physical therapists or other healthcare professionals, where they're telling them, oh, well, you shouldn't be doing CrossFit. But the same thing will happen with runners or other people who have some sort of niche thing that they like to do. Then they get hurt and the doctor or whoever just tells them, well, don't do that anymore. Well, if you know a CrossFitter or a runner, they're not going to listen to that. They're still going to do it and push into pain, which isn't a good thing, obviously. And so listening to them, but then also like, okay, so it hurts to do pull-ups and toes to bar right now. Okay, so let's have you work on this in the meantime, and we're going to scale back to this, but we're going to come back to this. This isn't a forever thing, but let's find a way to get you back to doing the things that you want to do, and listening to them about that stuff versus rather just saying, no, you can't do that. Or like I get pregnant and postpartum women a lot. And it's, well, my doctor told me or I've been told I should only do like prenatal yoga and walk. Like I've done CrossFit for 3 years. I don't want to not do CrossFit. I'm like, we can work with that, but we have to be smart about how we're doing your training or returning to postpartum or wherever. But I think the biggest thing is listening to the patients and helping get them to where they want to be, but not telling them, no, you can't ever do that again. And I'll tell my patients, I'm never going to say, no, you can't do that. Like, that's not my place to say that. That's your decision to decide if you want to do something, but I'm going to help you find a way to get to doing what you want to do. But in the meantime, we're going to do some stuff that isn't going to look quite like what you want it to be, but it's just a temporary thing. And I think like making that, like, this is just temporary, this isn't where you're going to be forever. That helps. Like, okay, like I can see like, and explain like, this is how we're going to progress it. This is why we're doing this. This is why we're doing that. I think that's one of the biggest things my patients love, is that I always say, well, this is why I'm doing this. And this is what I'm looking for, whatever. And it makes sense to them versus like just treating them and not explaining what I'm doing. Like, why is she choosing to do this random stuff? Or will this even help me? And then when I explain why it's going to help them, like, oh, that makes sense. And then they're way more compliant too.
So Katie, how does working for yourself in this scenario help you be able to explain that or to have those conversations?
Well, I like working for myself that I don't have to worry about, like, I don't have another patient coming in 30 minutes because I've worked in those clinics where you have a patient coming in every 30, 20 minutes. And so it's hard to designate that one-on-one time with patients when you're trying to do manual and all this hands-on stuff. And then it's hard to progress their exercise program and do everything in that 20 to 30 minutes that you're one-on-one with them before someone else comes in. But having that time where I don't have to worry about someone else coming in, I don't have to worry about, I'm supposed to bill a certain amount or bill certain units to maximize that visit or whatever. We could just treat every visit as how they come in. This is what they're feeling. This is where they're at. Okay, then do we need to deviate from what we're doing? The visits may look completely different from time to time, depending on where they're at, versus me trying to fit into this bubble or these expectations that someone else has set for me.
So having that time is really helpful for you to get
Yes.
that point across. And then
Yes.
also, like, you have this specialty where you can speak their language and you know
Yes.
how to scale those things appropriately. So I think
Yes.
that's really important for everyone who is interested in CrossFit or whatever other specialty. You probably already know this, but being really excellent at
Mhm.
not necessarily at performing that sport, but understanding the sport and understanding the scalability of it and how to break it down, that really sets you apart from other practitioners. There's lots of practitioners who want to work with CrossFit and who don't want to say no to them, but it's the ability to do that safely and effectively to get them back to pull-ups and toe to bar.
Yeah. And I think that kind of goes along with like any coach. Like, you don't have to be like an awesome athlete to be a good coach. You have to understand the movements and understand the progressions and all of that too. It's the same thing when it comes to working as a physical therapist athlete. I don't have to be able to, clean and jerk 200 pounds to be relevant to them, but I have to know how to look at the movements, look how they're moving, break things down, figure out where their issues are at, and then scale them and build them up from there.
Right. Yeah.
And I think that was a good example, Katie, of like taking that one-on-one idea to the next level. Because I think so many times like we see that advertised of like my patient wants to hear one-on-one care. But like what does that actually mean, right? Like why do they want to be one-on-one? And it's like so you have time to answer their questions, like Lauren said.
Mhm.
And it's like so you can actually explain why you're doing what you're doing so you can be more creative. So like I think rather than just saying like we give you one-on-one care, it's like why is that important? Like what does that actually allow you to do that you couldn't do when you have 3 people in an hour or 4 people in an hour? Because it's like it's not the one-on-one itself that they're concerned about, right? It's like what can you actually do when you're one-on-one or when you have that time that actually like takes it a step further and makes a difference to them.
What else? So what else do patients want that they're willing to spend money or drive further or spend more time in the clinic with you?
Or what are they frustrated with too?
Or what are they frustrated with that's driving that?
I was gonna say one of the things for us as far as why we want to do this in a way that patients can benefit from it is like some of those patients that might require more programming, like mobility programming, or if they want more of a strength program, having the time to do that. Because when I'm seeing patients back to back all day, if I do that kind of thing, then it's me spending hours outside of the clinic at home on my on my own time to do some of that. So I think having a little bit more time to get a little bit deeper into some of their treatment progressions than just kind of a simple home exercise program and some things like that. Which for a lot of CrossFitters in particular, they need more of, they want more of that program. They want to talk that lingo, and they want to know that you understand how to progress them back to those full movements.
Right. I actually really think that's important because even if you do spend a whole hour with somebody, it's really hard not to spend that hour literally treating with manual and exercise. And it's important and it's part of their care. And we have to like really coach ourselves to understand that part of that hour, and I'm speaking to like an out of network model.
Yeah.
So, right. So if you don't have to worry about like what units you're billing for
Yeah.
codes, you can literally spend 20 minutes sitting there and talking through their programming, and that's
Yeah.
part of their care.
Yes.
Pay for. But that's right. You can't bill ignorance for that.
Yeah.
Right.
But my challenge to you is to hold you to that, because it's very difficult when you take money from people to not want to literally be like hands on them the whole time.
Yeah. Yeah, I'm sure that would just be more of like a conversation with the patient too, of that when they see the value to some of the programming that you're doing, and it's probably going to be way beyond what a standard home exercise program that they've received in the past would be. Just because I feel like to put the effort into making a good program, you want to take some time to do that.
Can I ask a question about that?
Mhm.
About what you said? So, taking money from people, do you succeed with getting over that essentially by setting expectations before, or the session before?
Yeah.
Do you find that that's all you have to, like, you just let them know what's going to happen, and that way when they show up, they know how their money's spent?
That is
That's
a good
right.
question. No, it's a really good question.
Yeah.
And it's something we're going to keep coming back to, this challenge that we face for ourselves. But the biggest thing I think that we need to remember is that if they've already come in for their first visit, we've already had these conversations about money. We've already established to them that this is our payment model. And separate from that is our plan of care. And we're going to discuss that a lot. Like, how do we, like, you all are coming forward and saying, I want to treat my patient the way my patient needs to be treated. So now it is on us to follow through with that and to educate the patient. Yeah, at the first visit, like, this is what I anticipate. This is what I think our next visits are going to look like. Here's what the frequency I think is going to look like, and not worry about the fact that that's going to cost them money, because they already chose you and they already knew that this was going to cost them money. But that's our problem. That's like the hardest thing. Hold on, somebody's coming into the waiting room.
Well, I feel like it's also a way to connect with the patient to understand what their goals are and how they want to spend their money. Like, what do you want to get out of this kind of thing? Which gets lost in a lot of corporate settings. Like, are they doing input on their goals and how they'd like to spend their time? I mean, to an extent. I'm not doing manual for an hour. I don't care how much you pay me. But
Nobody needs
right?
manual for an hour.
No, I'll give you a card for a massage therapist. But
Lauren, that's a common theme that we see in these courses, is that there's this element of guilt of like, I am supposed to be like your healer. I'm like your medicine woman now because you're paying me money. But it's like, that's never was your job.
right.
So it's just remembering, like, we established ourselves as PTs at this level in this way, and you can keep practicing that way.
Mm-hmm.
But so I think you bring up a good question though, like, how do you get over it? And I don't know who asked that in the group document, but it was proposed, like, how do you get over your weaknesses?
And let's start to get into that question a little bit too. Like, just for now, we'll just focus on the weaknesses. I think the strengths are also important to highlight. But like, what do you feel will be the hardest thing for you about owning your own practice, or like being responsible for patient care, money, but like not as much on the clinician side of it, but like, what do you think is going to be really hard for you about starting your own practice?
Boundaries.
What was it?
Boundaries.
Okay,
That's a good one.
more. What do you mean by that?
Boundaries with time, boundaries with patients, like maintaining setting up the expectation of the boundary at the beginning, because I would like to have, they have not full access to me, but the way that we're going to communicate isn't through a front office anymore. So they're going to be communicating directly with me. So they'll probably have my number. They'll probably have my email, you know.
Yeah.
So establishing boundaries and flow of how this is going to go. But also my time boundaries. I'm going to like have to spend time with my children still. Like, I'm going to have to like cut it off at some point every day. And when I from what I hear, that's hard to do because we're all constantly working when it's ours, right?
So I don't know if this is helpful, Lauren, but my husband and I have like a side real estate business. And we have it in our lease where we have like a business phone, like through Google Voice. It just goes to our normal cell phones with like office hours, right?
Ooh, okay.
And then we have like another Google Voice number that's like for emergencies. Now, obviously, there really isn't like physical therapy emergencies,
Right.
but
We
that would
think
be,
there are.
but nothing hopefully that like I'm going to the ER for it, right? But that would be a pretty easy way to just say like, hey, these are office hours. I will happily get back to you within this time. Like, this is my office phone number. And they don't know that it's not like a brick and mortar actual landline, right? Because it's a different number than your cell phone. But that's pretty simple to set
One thing, yeah.
Google Voice up too.
Yeah. And I mean, cutting myself off at a certain time to be home kind of thing, instead of just being like, I'll just continue because I want it to be successful. So I'll just keep, yes, I can add another appointment at the end of the day. Oh, yes, I can add another appointment, and like establishing the physical like time boundary around things. Tend to be a yes person. So
I think one thing that has helped with that, like, because I give my number out to people, and honestly, it's 2021, people are going to DM you. Like, they're going to get to you no matter what barriers you put up. They're going to find you. And so it's about how reactive are you? Like, one of my weaknesses is I tend to be like really like a rapid responder, and I try to like not do that because I'm teaching them that that's okay. If I don't respond to you on Facebook Messenger, that gives you the message that that's not really like the right way to get my attention. Like, you can shoot me an email, right?
Yeah.
And so I think that some of that is just on us, and we just have to like sit and tolerate like feeling bad about it, but they're fine. And they can contact us in more appropriate ways. And if it is an emergency, we would of course be back in touch with them, but they probably wouldn't be Facebook messaging you then. So I think that like some of it, Lauren, is like you just, like it's on you.
Yeah,
And
I don't think that,
already know.
guys, I'm not assuming I'm the only one that's gonna.
Oh, not at all.
I think it's a few of us, right, guys?
Yeah. Right. Back me up, guys.
Right.
No, for sure. Like I mean, I struggle with that all the time. And so, but I have to recognize that like most of my patients now, years in, are like, hey, I'm sorry I'm bugging you on a Saturday. I recognize that this isn't appropriate, but I have this question, and I can choose to write back and say like, oh, no problem, blah, blah, blah. But 9 times out of 10, my patients literally are like, I'm so sorry. And I'm like, thanks for saying that. But like, I've kind of trained them to be like, this isn't really appropriate.
Right.
But I also am your coach at the gym, and I like hang out with the same people. And like, it's very hard when we're in these specialty practices to like untwist all of those relationships. And so it's like, they probably already have your number.
Yeah.
So, and I think because most of these folks are in some way going to start out as friends, it's okay to blur those lines, but then it's on us to be like, sometimes it's my actual patients / friends that are like, hey, you shouldn't be answering my text right now.
Yeah, I think I've had kind of the same issue with that, just since we've been getting more people from our CrossFit gym coming to see us and wanting to make sure that like, if they contact us, I can get you in soon. So like, okay, maybe I'm full, but I can see you over my lunch. So like making sure that, because like those types of people, I don't want to tell them no, but
Right.
if I always do that,
Yeah.
then it's
which
always going to be the
we're
expectation.
doing that this week.
Yeah.
Right.
And I think part of that too is like establishing from the beginning, like, because you'll have a stage where like, I just want to say yes to everyone. And that's okay. Like if that's where you're at, then it's just like, that's my policy and I'm going to say yes and I'm going to make it work. But then like establishing those boundaries. So then later on, you're like, okay, I've gotten to the point where I can say no. Like yesterday, I was in the clinic from like 7 to 6 and I got a text from my patient at 2 and he was like, hey, do you have any openings? And I was like, I really don't. But like in my head, there's still that thing of like, I could stay until 7. But then I had to be like, no, like this is my hour. And like I've already extended, like I'm done. Like these are my hours and I'm not doing it. But it's really hard, especially, and then he even responded. He was like, really? And I'm just like, well, clearly I haven't established boundaries before. But like you have to just kind of like, there's a stage where you're just gonna say yes. And then after that point, it's like you set the limit and then you just have to kind of hold it.
Yeah.
I think for us, my biggest weakness, or I guess worry about starting a practice, is just making sure that we get enough people coming in the door to keep it going.
Especially since
initially.
it's the two of us doing it together. So it's not like we have something else to fall back on. We're going all in.
Right. And that's why you're not going to say no to anybody.
Right.
You're say yes to everybody. Are you guys planning on like supplementing your income with your own work or something?
Yeah, most likely.
Yeah, probably,
Yeah.
especially initially. We'll try and do some per diem stuff. It's pretty easy to find for the most part around here, especially
Yeah.
at the hospital. So we will probably at least start with that to give some sense of security. But
And I think that's a good idea because that you feel less like bound to and you're more willing to say yes over here.
Yeah.
mhm,
So that will grow versus if you're staying in like your salaried outpatient job that you kind of like, that's harder to get out of.
right.
Plus, there's, I mean, sort of conflicts of interest there, being that Bozeman's not a huge city. So I don't think they'd be super stoked on us starting a side practice and continuing to see people there.
Right. And we'll get into this in the future weeks, but in most cases, you can't even legally do it.
Right. Yeah.
Insurance contracts.
Yeah.
So,
Yeah.
okay. So let's circle back, talking about like, what are some of the things that patients are looking for and how can we start marketing ourselves? So instead of coming out and our first social media post being like, I'm going to treat you one-on-one for an hour with a DPT, like what are you going to offer your community that's going to draw them to you instead of to that other outpatient clinic down the street who might be one-on-one for an hour?
I think one of the biggest things is figuring out like what, if you, especially if you have a niche, like what is one of their biggest problems and like, how are you going to solve it? So like me working with CrossFitters and pregnant and postpartum women, like, are you leaking when you do jump rope and box jumps and lifts or whatever? Like, I can help you with that. Like what are their biggest problems? And then you're presenting yourself as a solution to that.
Right. So being specific is kind of what you're saying. Like,
Yeah.
you
Yeah,
niche-
and that's going to draw in that niche population that you're looking for. Because I mean, I don't mind working with, like someone who's a 7-year-old woman who, walks for leisure activity and likes to garden and go out to lunch with her girlfriends, but she's not my niche population. And so putting out some sort of post or something about that, like, this is an issue, I can help you address this issue. That's going to help pull in my target demographic more than just anyone off the street. And they're also more likely to come to me than go to some other physical therapist, whatever, because I've already acknowledged that this is their problem and I know how to fix it, or I know how to address it.
Yeah. And then we will always argue that word of mouth referrals are the most important. And so then when that particular patient has that experience, they pass that on, that continues that niche building.
Yeah.
Okay, cool.
And then I was going to ask too about because I live in the suburbs of Raleigh, North Carolina, So where I am is very rural, but it's growing a lot. And so that's one of the reasons that my husband's very much on board with this as well, because it's, let's get in now, let's start this now, because I don't have a lot of competition right here where I am. Now, if you go further into Raleigh, you have, Duke and UNC and all of those. So they're going to have more of the facilities that might have some more of the up-to-date things, like all the, new equipment, blood flow restriction, anti-gravity treadmills and all of that fun stuff. So I think for me too, here in my area, it'll be good just to even start to even reach out like to some of like the little local gyms, like we have like the Fit for Life or yoga practices. And I didn't know if you girls had even worked with any sort of chiropractors, because I also I've heard a lot, chiropractors, they all start their own businesses when they graduate. So I think for me too, it was even, should I reach out to a couple chiropractors and talk to them about how they started their business and what their model is like? So I didn't know if you girls had ever had experience of reaching out to different gyms or yoga facilities or other. I don't know a lot about CrossFit. I'm not a CrossFitter, and I think there might be 1 or 2 CrossFit gyms here. I'm interested in it. I just don't know a lot about it quite yet. But yeah, so just kind of reaching out to different businesses around the area for marketing purposes too.
I think that's really smart. So there's a chiropractor in my building, and it's like kind of controversial because people will be like, oh, isn't that bad for your business? But we like collaborate all the time and share patients. And I see him as a patient myself. So I think if you can recognize that collaboration with other small businesses in general is important, like whether or not you do CrossFit, it's still helpful for you to get to know that business and to talk shop with somebody about like what it's like to be a business owner even. If that's a relationship established, then you can somehow get into that community even.
Yeah,
Have you guys joined? Sorry.
I was gonna say with our experience, so one of the chiropractors at our gym has been a really great referral source for us, just because he's seen kind of the value in some of the stuff that we do, because he's in a clinic that sees people probably every 15 minutes. So he's just doing the manipulations, maybe a little bit of dry needling, and he's gotten to the point where he's like, I know these people need more, but I don't have time to give that. I can't give them that time. So he just sends them to us.
Well, and I think the big thing too, at least in Bozeman, there's a couple other PTs at the gym that we're at, but they work for a bigger organization, and they don't really, it's more of like a bigger corporate company. So they don't really get to keep their own patients and see everybody for, and get the full time with everybody. So we're kind of the first ones to come in that know the movements, that have are there often, that he trusts to start sending people to, because before we just didn't really know where to send them to. And we still have a lot of members at the gym that are like, don't PTs hate CrossFit? Like, don't they, so it's kind of fun for them to be like, oh, there's actually PTs that do CrossFit that would work with me and know what I want to do, and not just tell me, well, you're getting older, you should stop doing that, or it's not good for you.
Right.
I don't do CrossFit either.
Okay,
I used to do CrossFit. I couldn't afford it at the time, and then I had babies. So I even with my corporate job outside of Raleigh, I have joined my specific clinic with the Chamber of Commerce, which I found to be very helpful, because if you're in a growing area, it could be helpful, it could be garbage, but usually they're big on small businesses and small business support, and they'll support you in social media as well. But I really think like all these like parent groups, mom groups, community groups that are showing up on Instagram and stuff are where all that free advertising, word of mouth stuff comes in. Yeah. So not just like shaking hands with the neighbors, and maybe like we do a lot of like clearing the snow out of the next door neighbor's sidewalk, like just to be friendly, but little things like that. But then also taking advantage of the chamber and social media stuff.
Awesome. Thank you.
Sorry. No, that's great.
But I love that stuff.
I love it. Like if you end up clearing somebody's driveway, or like, let's say like somebody cleared yours in front of the clinic, then you post it on social media and shout them out. Like
exactly.
I think it's about like kind of karma, right? Like you shout out other businesses and shed light on them.
Yeah.
And that's great.
I don't know if you have snow in Raleigh though.
Mhm.
Can we
A little
talk
bit, but not a
social
lot.
media for a second?
Yeah.
Because I feel like I am going to be terrible at social media. I know this is a weakness of mine. Do you guys ever like outsource this or like get a consultant for social media? Because I mean, I know obviously that like adds to your overhead, but I just feel like if someone could do that so much better than me, it would probably be better for the business in the long run.
We're gonna argue no. We're gonna argue that isn't gonna be better for your business. We'll talk about this a lot later,
We'll
but
get into social media
yeah.
a lot. But yeah, I think for right now, like maybe later when you've like built up the budget and the patience and you're like, this is a place I want to go, we'll talk about it.
Okay.
I guess like my argument is kind of like very simply, social media is not gonna like make or break your practice most likely. So to put a lot of money into that up front, like you could probably better like put that to better use somewhere
Okay.
else.
And I would add to that argument, like that's fiscally an important aspect. And like, again, we're talking about like local community networking, most likely, most of us. And so you are the person that people want to hear from, right? And you're the only one who can really speak to that community, at least at first, right? So, but you're not alone, Andrea, with like feeling this way and feeling nervous about it and like unpolished. We'll talk about it.
And I think that's also like, as we're talking about strengths and weaknesses, like that is a weakness that a lot of people list as they're going into this. Like, I don't know how to advertise, I don't know how to market, like I don't know how to do social media, and you're not at all alone in that.
Yeah. And you don't have to like it, but you're not going to spend money on it yet. We're not going to let you spend money on that yet.
Okay.
But yeah, we'll get
Noted.
a bit more for sure. And so speaking of that, a lot of you already did this, but in that group Google document, if you have some like business handle for social media, or maybe you have your personal handle that you want to share, but maybe you're putting stuff on it that's kind of business related or PT related, I'd love for you to share those so that we can start following each other just for that like support, right? And then it also just like the more that you see what people are putting out there, the more that you're like, oh, it doesn't have to be so scary. Like my last social media post was me pointing at a sign that said, do your exercises. Like and I wasn't explaining anything like about a clean and jerk or anything, like just do your freaking exercises. That's it. So, right. It can be simple. And I think the more that you expose yourself to that, we'll get into it. Okay. So we'll send out the week 2 material tomorrow morning. Try not to send it out tonight because we want you to like think about this stuff. Any last thoughts for this meeting?
I just had one other quick question, which I don't know if we'll get into this later down the road, but because I've always worked for like a hospital or physician-owned practice, what do you guys do for like liability insurance? Because that's kind of maybe like just like moving forward, like what that's all about.
You're going to need to purchase it. Yeah.
Okay.
Yeah.
And is it like, so like that's just something that you're going to have to add to like the overhead and all of that. Okay.
Yeah. And I think it's next week. There's a resource with a couple links of the ones that we recommend.
Okay. Awesome. Thank you.
Yeah. Most like 90% of the things that are on your mind, we're going to get to,
Yeah.
but just so you guys know, like, it's okay. Like write them in the Google Doc if you're thinking of it. And then we'll let you know like, oh yeah, we're going to get to that. Or you need to know it urgently. We'll tell you. We just don't want to give you everything. Right? Gotta absorb it. Okay, cool. Nice to see you. Reach out if you guys need anything. Otherwise, we'll see you next week, back to normal time. Thank you. I just have a meeting at 6. All right. Have a good rest of your week. See y'all.
Bye, thank you.
Bye.